What is academic medicine? Let's start there first, right? So there are different types. You can be a doctor and do different things. In Probably the one you see on TV the most, right, is private practice, where somebody has a clinic and they see patients kind of all day long with a break at lunch, and then they go home, right? That's called private practice. But when you are affiliated with a university like Johns Hopkins, we are in what's called academic medicine. And what that means is we not only see patients, but we also do other things like inpatient time at one of the hospitals that's associated with the institution, or education, right? Teaching the residents or teaching the undergraduates or teaching others, administrative stuff. So when you're and probably most commonly research, right? And whether that's clinical or basic science or translational, and often that's grant supported. So an academic neurologist or academic clinician is somebody that does more than just clinical practice. They have different facets to their career, and no one person is going to look like any other person. So the amount of clinical work that I do, and the amount of research that I do, and education that I do, and admin roles that I do varies from the person that's sitting next to me, which is kind of cool. And you can really, again, I told you this was going to be a very unbiased talk. You can really make it what you want it to be, if that makes sense. So what is it that motivates you? Do you want to do a lot of research and get a lot of grants, but do a little bit less clinic? Do you want to do more clinic with some of that? So it's a really great way to kind of make medicine what you want it to be. Okay, so today we're going to talk about a couple really important pieces as you're starting to get a taste for academic medicine and what that's like, and thinking about going to medical school. So we're going to talk about getting a mentor and what that mentor-mentee relationship looks like, because I've seen it look really good, and I've seen people not get so much out of it. And I really want you to be in a position where you can maximize what you're getting out of it. We're going to talk a little bit about becoming part of a lab and starting a research project because, to be perfectly blunt, and Davina, I'm sure, has talked to you guys about this too. Medical schools like to see that you've done some research, right? Gotten a taste for what that's like, what that scholarship is about, and that you like it. So that's important. We're going to talk about participating, right? What should you be thinking about saying yes to and being part of? What does schools like to see? We're going to talk about, for those of you, and some of you have already heard a lot of this, but we're just going to breeze through when you are in a clinical or research environment, kind of some things to be thinking about how to handle that. And then we're going to talk at the end just about the gray zone of medicine. So there's some things that come up that I think it's worth thinking about before you are part of a shadowing experience or a research lab, just to kind of have a leg up as you're thinking about things. So let's start with the mentor-mentee experience. And I think that this is really important in life in general, but certainly as we move forward in medicine. And I'll tell you that it used to be kind of this apprenticeship model, right? It's like the blacksmith that had his apprentice that taught him how to make horseshoes just like he did, right? And that happened in medicine for a very long time. You would follow the person that you want to be just like around, and that's what you would end up being. That's not necessarily how it is anymore. Now, more commonly, people will have mentorship teams of people that they like and respect that have pieces of what they want to pull in. So no one person is you anymore. You might have somebody that you think balances their life and career very well, and you want to speak to them about that piece of things. You may have somebody that's very interested in your research interest, right? But your clinical research or your clinical interest is different. So when you think about a mentor, I don't want you to get hung up on who do I want to be like. They don't want to make mini me's. They want to help you to be the best that you can be. And most of the time, at least as I help people to get mentors and think about that as the vice chair of education, I'm creating mentoring teams for trainees. But we're going to start with one mentor at a time. And what I want you to think about is it's never too early to start talking to people about their experiences. Mentors will change over time, right? The people that you're listening to now, and that are helping and providing you a lot of advice may not be the people that you turn to once you have a more solidified interest in a certain topic area, as an example. But what I want you to take away from tonight is that mentorship is not a one-way street, right? So that both of you are going to put in really important things to get the most out of things. So what does your mentor have? Your mentor has expertise, right? They've been doing this a while. They have experience and knowledge. And their role is to help teach and guide you and help shape your professional growth, help guide you to, oh, that sounds like it would be really interesting, and to serve as a role model. They want to give you feedback if they see you doing something great, or if they see you doing something that they say, hey, why don't you think about doing it this way instead? Right? But they don't want to create a mini me. And at least that's what I tell the good mentors, right? You want to make sure that you're getting the best out of your mentee, but that might not be what was best for you, right? So you want to take your mentee's skills and to help hone those, and do what's right for them. But the mentee brings a lot to the table as well, right? So it's equally important in setting the tone. And we're going to talk about that in just a few minutes. So you guys are here seeking guidance, right? Constructive feedback, opportunities. And you really have a crucial part in this as well, right? You have to keep your mentor in the loop about how things are going. As you're talking about things, you need to then take that and have action and then bring back how that happened and kind of the progress so that you can continue down that path. And if things deviate a little, get back on that path or maybe take a new path, right? Um, you need to be aware of your own areas for growth, right? And kind of be in charge of knowing what ultimately what is and is not going to work for you. So there's really three stages when I think about establishing a successful partnership as a mentor-mentee relationship, right? There's the initiation where you find the person that you think would be a good fit. And it's really important during this initiation phase that you meet and that you talk through the common ground and the expectations. So you get to know each other and you get to know the interests that you both have, but you also want to set some ground rules about what you both want out of the relationship, right? And that's really important because it may mean that you meet fairly regularly. It may mean that you don't meet much at all. It may mean that you're dictating a lot of the things that you want to talk about. It maybe they are. So establishing that common ground and those expectations are going to help you both know what you need to bring and be prepared for the meetings. And that helps you to make sure that you're having a productive collaboration, but also that people aren't getting frustrated, right? I can tell you that I've definitely had mentors that have been frustrated with their mentees. And then I said, but they're on a busy clinical service, right? Well, they had never talked about the fact that, wow, they're on a busy service and can't come back and talk to them, or yeah. So that communication made it appear that that mentee didn't care when in reality it was just a communication thing. So establishing some of those ground rules and the expectations for what you're hoping to get out of the relationship is really important. Cultivation is kind of that middle phase where you're working together. And if, for example, this is a research mentor, maybe you're carrying out projects. If it's a mentor that's helping you to kind of figure out your role in medicine or your interests, then maybe you're talking through experiences or things like that. But that's the piece of the mentee mentor relationship where you're meeting and you're making decisions and you're kind of going along that path. At some point, again, mentor mentee relationships will change. And as a mentee, you may outgrow or need a different set of mentors, right? And that's okay. Maybe you were in someone's lab and you gained those skills, but now you're going to move on and you want to take a slightly different interest, right? So there'll be a separation phase where maybe you're not never going to talk to that person again, but they're no longer that big piece of your life. And that's where reestablishing those expectations and what those roles look like can be really important. So if I can suggest when you're meeting with a mentor, and again, you don't need to do this necessarily on day one, but you want to make sure that you're sitting down and having a good communication and setting really clear, achievable objectives, but both for the short term and for longer term, right? So what am I going to have for you by our next meeting? What are we going to make decisions about for our next meeting? Okay, what are we thinking about for next year, right? Or for 3 months from now? Or when are we going to, this project, what's the first phase? Okay, what's that look like? What is the longer phase, right? And you want to make sure that you're reevaluating periodically because things change, right? And that's okay. All right. A huge piece of a good mentor-mentee relationship is effective communication. Like I was saying, I can't tell you the number of things that really hinge on that and that have gone awry in good relationships because it's not clear. So you want to have an open and honest dialogue with regular check-ins. So I've had some mentees that are so well intentioned, but then all of a sudden they realize, wow, this is a lot. Like I'm in the middle of a semester, or my workload just got really high. I can't do this, right? I can't. I said I was going to be done with this in 2 weeks. I'm nowhere close. That's okay. These things happen and they change, but you want to make sure you're talking and you're saying, okay, I'm finding this challenging. Let's reassess and let's regroup. Not telling your mentor or not telling your mentee can really result in some miscommunications that can really hurt that relationship. So you want to have regular check-ins and feedback. I also find that with a mentor, you want to have regular meetings. If you just say, oh, I'll reach out and we can meet sometime in the next month, do you know how long the average is before that next meeting actually happens? I'll make if I bet it's more on the in the line of 2 or 3 months, right? Whereas if you're meeting every other week or once a month regularly, then sometimes you'll meet and you'll say, listen, we don't have much to talk about today, but what are we going to do for next time? But it keeps you on track. So those regular meetings can be really important. You want to make sure you respect one another. And that's what I mean as far as time, right? And skills that both of you bring to things. But you want to be flexible. Okay. So how do you build that trust? You want to create a safe space for discussion, right? And again, this is you're going to be able to talk through problems with your mentors, and you're going to be able to kind of have some really important open discussions. And you want it to be a confidential environment, right? So what you tell your mentee or what you tell your mentor isn't necessarily going to go and be broadcast to other attendings, right? And nor is what they tell you going to be broadcast to other students. So you want to have a confidential space where you